guest speakers. We have Sasha Rappaport, Cheng-Sim Lim, and Sean Broadbent. Sasha joined the movement for single-payer healthcare as a volunteer with National Nurses United in 2019, fighting for health justice by organizing for HR 1384, the Medicare for All Act, and AB 1400, California Guaranteed Health Care for All. He is a community organizer and board member with LA Forward, fighting for policies that will make Los Angeles a fair, flourishing place for everyone. He also chairs the Housing, Renters, and Homeless Committee for his neighborhood council. Cheng-Sim Lim's road to becoming a single-payer activist began when a cancer diagnosis in 2006 opened her eyes to the inequities of the health insurance system. Since then, as a volunteer organizer, with the NNU CNA, she has worked in support of improved Medicare for all nationally and state single payer in California. She is currently also the outreach liaison of Healthcare for All Los Angeles and is active with DSA LA's Healthcare Justice Committee and Progressive Asian Network for Action. Sean Broadbent has been active for single-payer healthcare since becoming a volunteer community organizer with National Nurses United in 2019. He has worked to support HR 1384, the Medicare for All Act, and AB 1400, California Guaranteed Health Care for All. He is co-chair of the Democratic Socialists of America, Los Angeles Healthcare Justice Committee, and an active member of Healthcare for All Los Angeles. Sean believes that healthcare is a human right and that enacting single payer is the beginning of justice in health. Thank you all so much for being here. We look forward to.
Yeah, thanks so much, Holly. Stefan, thanks so much for the invite. It's really good seeing you on Public Citizens Medicare for All Resolutions call. Really grateful that they're doing that organizing, connecting all of us together so that we can share what's working and learn from one another. So tonight, just here at Cheng-Sim, Sasha, friends from here in LA, where we, over the last 2 years, have organized twice together for a single payer system. The first time on a national bill, HR 1384, and then this time around, AB 1400. And in addition to other strategies that we're using to help move these forward, help advance them, we've worked specifically together on passing resolutions on the municipal level here in Los Angeles. And we came across something that felt like it really worked well for both getting a lot more people involved, getting them connected to it, and also being able to just effectively advocate in a city as large as LA to be able to approach City Hall. So to kind of wind it back, in 2019, at the start of the year, all three of us kind of jumped right into the push for HR 1384, joining National Nurses United by hosting Barnstorms, which is just a really funny name for a local getting together, local meeting. So we all hosted local Barnstorms, myself in Glendale, Cheng-Sim nearby in Los Feliz, and Sasha over in Eagle Rock. And we were so successful with our Barnstorm that our legislator just immediately co-sponsored. So we were kind of found in the situation of like, wow, we did such a good job rallying for the cause that where do we go now? Well, turns out there were a lot more legislators in Los Angeles City and County. So initially we kind of went out to different parts of the county and continued door knocking with some of the same people and meeting together and organizing in that way. But Cheng-Sim was good enough to host teach-ins at her house. And it was during these teach-ins where we were discussing what was working and also going over the specifics of the bill that we came across a really important idea about how to pass a resolution. So Before I get too much into that, maybe Sasha or Cheng-Sim, would you guys kind of like to talk about just that initial effort there with HR 1384 or the teach-ins?
Sure. I think I can take the handoff from here, John. Yeah. So we started as kind of a small group, kind of that disparately came together through a larger organizing body, which was National Nurses. And from there, we were able to connect with other groups that have been fighting for single payer as well. One of the challenges around any organizing efforts are needing to collect the different groups and build coalition. And I think we were able to just effectively do that in Los Angeles, to the point where we were able to then kind of focus on the different kind of levers of power: county, city, and then lucky for us in Los Angeles, there are bodies called neighborhood councils. And so neighborhood councils, there's actually 99 of them across the city. That doesn't include incorporated areas. Los Angeles is a giant mess of a metropolitan area, but what that really means is there is a form of representation at different neighborhoods, roughly between like 40 and 60,000 people. And so we looked to connect in with both city council members, county board of supervisors, but then the real grassroots efforts were at these neighborhood councils. And so we the first steps are learning about how different bodies derive their power, and how they can kind of flex their muscles in the larger kind of infrastructure of government. Neighborhood councils in Los Angeles are able to write what's called community impact statements, which are letters that essentially are attached to city council motions. Long story short, before there was a motion, we had to go to these neighborhood councils to ask for them to create resolutions before the city did. And so that's what we started doing. And honestly, all I've said to this point is kind of immaterial. What we really did as an organizing group was go to the communities and talk about single payer and form relationships with the communities in order to find the stories that really resonated to everyone. So talking to people that are coming from, that are first generation immigrants, families that were undocumented that had no health insurance, people that went through similar stories like Cheng-Sim, who firsthand felt and were met with the obtuse, horrific systems that we currently have in place. So going through that and talking to the communities and amplifying their stories and sharing them led to us being able to start gathering that support and passing resolutions that then were connected to the city government. Then at one point, the city government, through pressures from a number of different kind of bodies around that were organizing, were able to actually get a motion passed. Language that came directly from what we had created at the neighborhood level, along with Citizens United, Public Citizen, that they created for kind of the larger organizing effort for creating resolutions. So literally that language was then, just slightly adapted for the city of Los Angeles. At that point, we were then able to go back to these groups that we had relationships with. The most important, piece of this is continue to build those relationships with these different community organizations, in this case, our neighborhood councils, to then go back and say, hey, we need your support because now we have a way to show the actual impact. So then we got community impact statements. And so over a course of a few weeks to I think it was like 2 months of direct, active organizing, we were able to get enough community impact statements. Sean, correct me, I think we had like 15 community impact statements, 14, 15 out of like 19 resolutions. So we, 19 different neighborhood councils basically sent in multiple letters to their representatives, to the point where we were able to actually have a little bit of leverage, and then they brought that motion to city council. And then from there, maybe I'll pass it back to either Cheng-Sim or Sean to talk about the day of and what we did to actually organize people to show up to make public comment and to advocate the day that it came to LA City Hall.
Sean, why don't you take that, and I'll follow on the state level efforts that we're making now.
Sure. Yeah, that sounds good. So on the day of, we definitely wanted to, we didn't know when it was going to come before City Council, but we definitely had subscribed to be receiving the agendas. None of us were inside of City Hall being fed that information, but we did get the email alert just like everybody else did. And we immediately worked the phones for all the activists that we had been knocking doors with or been making presentations with. And we especially invited our neighborhood council members who had submitted a community impact statement because they actually got an additional amount of time to speak at City Hall. So then we were able to kind of go through with them, what talking points might be that they might consider. If we had talked to them about their personal story, really encouraged them to tell the personal story because we find that's what's most powerful. And here in Los Angeles, this gets kind of broadcast out on like a public access channel as well as being available online, so that there are multiple ways that we can kind of signal boost this and make this like a day of advocacy for single payer. So we got the folks together, kind of confirmed who was going to be present, and then we had a very simple rally out front of City Hall, just not with a sound truck or anything fancy, but with a megaphone. And then we had from the local Nurses United rep some signage for Medicare for All for HR 1384. We were able to space out really nice on the City Hall steps with those, give our testimonies, and then having heightened the energy of the group, kind of marched into City Hall together and signed everybody up for public comment. That was really important. A lot of people needed to be walked through exactly how to sign up for public comment as they're going in the door. So just making sure that you've got people who can help handhold through events like that, really important. And then, I don't know, what did we have? We had like, I want to say an hour or two of testimony. It was really, really powerful there in the city chambers. And then a really good passage of the resolution with support from the majority of the council members. And then I'd say the biggest effect from that we were able to go then and use is we focused on a certain part of the city where there was a holdout member of Congress. And that member of Congress, when the new Medicare for All bill was introduced, was an original co-sponsor this time. So we took the resolution, we focused in on that person specifically, made sure to stay present in his district, and continued to organize. And that's the most important thing. Like, a resolution doesn't do anything more than the activists who are going to then go make use of it. That's what I would say is the biggest takeaway. And then Cheng-Sim, we have this wonderful opportunity this year, thanks to the nurses and also Ash Kalra.
Yeah, so we there have been several attempts over the years with California to for a state single payer bill, and it's been difficult. There were times when the legislature passed it, but then we had Arnold Schwarzenegger as the governor, and he vetoed it twice. But then, the thing that we've learned with California is nationally, they can point to the, Democrats can point to the Republicans and say they're the ones blocking anything, right? In California, they can't do that because it's a supermajority Democratic state. The governor is Democratic. He ran as a supporter of single payer, but then when he got into office, he's been walking back that support. So there is, so I guess for us in California, it's not a question of what party they are. It's a question of, whether they're bought by the medical industrial insurance complex, or they're not. And it's a Republicans are actually immaterial to our fight for single payer in California. It's all about the corporate Dems and the ones that are, you know, are not corporate Dems. So, but it's a tough fight. You know, it's very, very clear in a state like ours that the insurance pharmaceutical industry, they have a lot of money and they have a strong grip on power. It's a very, very tough fight. And, you know, you would think with the supermajority that we have, we should have gotten single payer years ago. There have been financial studies made, you know, for the viability of state level single payer in California. And, you know, they all show that the state's gonna save money. Even the first year of implementation, the most recent sort of survey of state single payer systems, the financing of state single payer systems, UC San Francisco released this survey of a whole bunch of financial studies. And it came out just last year, 2020. And they found that in 19 of the 22 models, not some of these studies were undertaken by, you know, conservative think tanks and whatnot. But anyway, 19 of 22 models predicted net savings in the first year after implementation, averaging 3.5% of total healthcare spending. So what I'm trying to say is, what we have found in California is that it's not financing that's the problem. It's not support. A recent poll in California just came out a few days ago, and it said that, you know, 80-something% of Democrats. This is a poll actually taken about the recall, the recall for the governor. But they said 80-something% of Democrats in California actually support state level Medicare for all. So it's not a question of like support, you know, in terms of the population. It's not financial viability. The problem we have in California is very clearly a problem of political will. We have politicians that just are blocking blocking state single payer, you know. So that's our fight. And what we're doing, you know, I mean, there are people who are, you know, doing the legislative track, right? But Sean, Sasha, and I, we are grassroots organizers. So we've been, you know, more focused on that. And the latest bill for state single payer, it's called CalCare, AB 1400, and it's sponsored by the California Nurses Association, introduced by Assembly Member Ash Kalra. And so it was introduced in February, and then it's been tabled so that, you know, it'll come back next January, basically. So we have 6 to 8 months of organizing statewide to get it to the point where our state, you know, our elected officials, you know, feel that they must vote for it. And that can only come with pressure from their constituents. And that's what we're focused on now. And using the lessons that we learned from the resolutions effort for the Medicare for All bill nationally. One of the things that was very interesting that we didn't anticipate when we started that effort in 2019 was that, you know, we thought, okay, well, you know, a resolution is a resolution. And like Sean said, you know, you use the resolution afterwards, right? But one thing we hadn't anticipated was a really good lesson that we learned was that the process of actually organizing for the resolution is actually a process of base building. especially for us in Los Angeles because of this neighborhood council infrastructure, that this was, that reaching out to the neighborhood councils and educating ourselves, that we had to educate ourselves in order to go speak with each neighborhood council. And the process of educating ourselves was essential to, essentially equipping ourselves to talk effectively to make the case for Medicare for all. So, so organizing at the grassroots level with, all of us having to go speak, like each one of us has to go speak to our neighborhood councils and make the case and present the case. And so we took the opportunity, to educate ourselves and made us, essentially, stronger advocates for single payer. And then talking to the neighborhood councils, that's educating them on single payer, because a lot of them didn't know what Medicare for all was, and that was a way for us to address some of their worries and the concerns and the propaganda that comes from the insurance industry. In 2019, we found a lot of it was, how do we pay for it? How do you pay for it? And something interesting now is that we're not finding that question much anymore. We've started reaching out, and already we've had, I think, 7 or so neighborhood councils that have already passed community impact statements in support of the motion that has already been introduced in the Los Angeles City Council by a council member, Mike Bonin, who some of you who attended the public citizen event a couple of maybe last month might have seen that. So anyway, we kind of were able to skip over some of the steps we had to take in 2019 because we had a supportive city council member this time who could jump in and just introduce the motion. So that saved us a lot of work in the beginning. But so we are now speaking individually, to the neighborhood councils to pass community impact statements in order to try to move the motion out of the committee in the city council. So educating the neighborhood councils now, it's really interesting because we're not needing to, to make the argument about why we need single payer anymore. People, we needed to make that argument we found in 2019, but now I put it down to COVID, the COVID experience. People see it very clearly that we need single payer. So, but what we are doing is that we're educating people about this new single payer.
My grass is greener.
A lot of people, know about Medicare for all nationally, but they don't really know what's going on at the state level. That there's this new bill, and it's called CalCare AB 1400, and what does it do? So this time we are educating people about the state bill, letting them know what it is about. And the third part, which has been really good about this grassroots organizing, is that, as we educate people, we end up being able to activate new people, bring in new people to the movement. So that is the sort of, base building benefits out of this resolution process that we didn't know about when we started doing it, through Public Citizen and the Nurses Union in 2019. And then this time we're thinking, that each stage of our resolution effort needs to be a way to, we need to build on it stage by stage. So if we can pass the resolution in the LA City Council, that's very important because Los Angeles is the largest city in California. then we want to also get other cities in the LA County to also pass similar resolutions. And if we are successful in getting, enough of shall we say, momentum, we want to, go to the LA County Board of Supervisors, and LA County is the largest county in the country, not just in the state of California. It's huge.
And it gets at a dynamic that, like, the Bay Area was very quick to pass these municipal resolutions, and also at the county level. LA as an area, much slower. So far, it's actually outside of LA that we've seen some resolutions passed in Southern California. So we have this kind of, like Cheng-Sim was saying, a corporate democratic governance that we're kind of needing to really push them to act on the support that exists. The 84% of Democrats, who are the majority in Los Angeles, want them to take action on single payer, on this bill that exists, that's here, that's right in front of them, and can take action on it. Before we get to Q&A, some folks probably have heard that the bill was tabled. And so just a quick little thing on what that means. We've spoken with the author. He is going to be continuing to meet with legislators to get their support for co-authoring. And he specifically asked for us to continue passing municipal resolutions so he can point at those and say, here's what your constituents passed in your area and what they want. And California operates on a 2-year legislature. So in Texas, it'd be game over because this is their last month to meet for 2 years. See you in 2023. In California, we'll be back in January. So we have a actual short amount of time to build the groundswell of support that we're going to need to take on the corporate intransigence. So wish us luck, okay?
And yeah, and then the other part of it, in terms of using this resolutions effort is, this continuing upwards pressure, right? So if we're able to get these resolutions passed at the municipal level, then, when constituents, organize legislative visits, right? So they can come into those meetings saying, your city passed this resolution. Why aren't you supporting it? If the state legislator isn't supporting it, or if they're supporting it but are kind of, not doing much to champion it, then they can use this as ammunition, resolution as ammunition to sort of stiffen the spine of their elected representatives. So it's thinking, we're thinking more clearly this time in terms of like building at each stage, like we're going to use so the as Sean was saying, the author of the bill, is saying that the resolutions will work for him and his fellow co-authors and co-sponsors of the bill in the state legislature to use as a persuasion or stick, to get their fellow legislators on board, right? So they can use this municipal resolutions tool in their corner, and then we on the outside can use the resolutions tool in putting upwards pressure on our own state representatives. So it's something that is a tool that we can then use besides just thinking about it as a resolution. And for us, because LA County is huge, LA City and LA County is huge, even if it's slower, it'll have a big impact in terms of the state. So the other thing I wanted to mention about our state single payer bill, which I'm very, very pleased about, is that it's the first bill. Now I don't know about the other state bills. So, but in terms of the California state single payer bills, it's the first California state single payer bill I've read that clearly integrates multilingual, culturally sensitive care, that it really integrates equity as a key part of the bill, that it's not something that you set aside, that in order for there to be true healthcare for all, right, healthcare justice for all, that in a state like California, which is, you know, majority minority, having multilingual, culturally sensitive care is key to having equity in healthcare delivery in the state. So that, for me, I mean, language is very dry and legalistic in the bill, but to me, it's very beautiful because it's the first time I've seen that in any state single payer bill in California. And then the other part of the bill that I like and is, and I saw that, you know, in your summary, Stefan, in your slideshow, that I saw that you have that also in your Connecticut. So that's very exciting. And that is for the first time in a long, long time for California anyway, we have a single payer bill that is a true single payer bill, meaning it removes the HMO loophole, the Kaiser loophole, we call it, because the last state single payer bill that was actually blocked, it passed the state Senate, but it was blocked from even getting any consideration in the state assembly by the assembly speaker. That was in 2017. That bill actually was supposed to be a single payer bill, but it had the Kaiser loophole, and Kaiser is a big, important healthcare, you know, medical industrial complex player in California. They constitute 1/3 of the medical delivery infrastructure in California. So this bill removes that loophole. It takes away the ability of Kaiser to, you know, to operate as an insurance entity. They would still be able to function in terms of their hospital and healthcare functions, but the insurance business that they run would not be able to go forward. So this bill is a true single payer bill, and that's lovely. It's not a multi-payer bill masquerading as a single payer bill, as previous single payer bills in California have been. So yeah, we'd be happy to sort of learn from, you know, what you're doing in Connecticut as well.